A patient's frustration turns into a lesson. Mr. Asante, a retired teacher, walked into Sunrise General Hospital for a routine checkup. He approached the receptionist with a warm smile, only to be met with a cold stare and a dismissive tone. Receptionist, take a seat next. Feeling ignored, he muttered, "Why do hospital staff treat patients this way?" As he waited, he saw a nurse scolding a patient, a doctor rushing past without greeting anyone, and an administrator arguing with a frustrated relative. Mr. Asante shook his head. Is this how we treat people who come to us for care? Later, the hospital's management received a complaint about poor customer service. The director, Dr. Nana Mensah, knew something had to change. We don't just treat illnesses, we serve people. It's time we start acting like it. And so, a customer service revolution began. Understanding customer service in healthcare. Dr. Mensah gathered the staff and asked, are our patients just patients or are they also customers? Some staff murmured, confused. Hospitals serve patients, not customers, right? Dr. Mensah shook his head. A patient is a customer. They choose where to receive care, and if they don't feel respected, they will go elsewhere. He outlined why customer service matters in healthcare. 1. Better patient satisfaction. Happy patients trust the hospital and return for care. 2. Fewer complaints and lawsuits. Satisfied customers don't escalate issues. 3. Stronger hospital reputation. Great service attracts more patients. 4. A more positive work environment. Happy patients make staff's job easier. Example: two hospitals offer the same medical treatment, but one treats patients with warmth and respect. Which one and respect? Which one will people prefer? The harsh reality: negative public perception. A survey revealed why people dislike hospital services. 1. Disrespectful staff, cold body language, rude tone, lack of courtesy. 2. Unresponsive behavior. Patients left waiting for hours without update. 3. Lack of empathy. Healthcare workers appear detached or uninterested. 4. Poor communication. Patients feeling ignored and uninformed. Example: a patient's mother begs for help, but the nurse barely looks up from her phone. How does that make the hospital look? Dr. Mensah sighed, if we want to respect as professionals, we must first give respect. The 4 pillars of exceptional service. Dr. Mensah introduced a simple yet powerful mantra: PPWR: professional service, personal service, warm service, responsive service. Professional service: know hospital policies and procedures, maintain high hygiene and dress standards, take pride in your work. Personal service: treat each patient as an individual, not a case file. Respect patients' rights and choices. Ensure their comfort and well-being. Warm service: greet patients with smile. Show sincerity and care in every interaction. Responsive services: address patients' concerns quickly and empathetically. Listen actively and offer clear explanations. Example: imagine being a patient. Would you rather be treated with kindness or indifference? Who are our customers? Dr. Mensah explained external customers, patients and their families who rely on our care. Internal customers, our colleagues who depend on us to do our jobs well. When we serve each other well, we serve patients better. Example: a nurse delaying a lab report affects the doctor's diagnosis, which affects patient care. Every role matters. Creating emotional value for patients. You can't separate emotions from healthcare. The challenge is managing them. Dr. Mensah taught staff to focus on 4 emotional needs of patients. They need to feel welcome. A simple good morning can ease anxiety. They need to feel important. Patients should never feel like a burden. They need to be understood. Listen carefully to their concerns. They need to feel comfortable. Ensure clean spaces and kind interactions. Example: a child comes in for an injection, terrified. Instead of ignoring his fear, a nurse kneels, smiles, and reassures him. That's emotional value. Simple actions that create a wow experience. Dr. Mensah shared easy ways to elevate customer service daily. Acknowledge patients immediately. Even if busy, make eye contact and say, I'll be with you shortly. Use positive language. Instead of, I don't know, say, let me find out for you. Maintain a calm tone. Patients may be frustrated. Stay professional. Go the extra mile. Small acts of kindness make a big difference. Example, a receptionist offering to call a taxi for an elderly patient leaves a lasting impression. Customer service in action. A hospital transformed. Months after training, Sunrise General Hospital looked different. Staff greeted patients warmly, nurses checked on patients frequently, doctors explained procedures clearly. The hospital's reputation improved drastically. One day, Mr. Asante returned for a checkup. This time, the receptionist smiled. Good morning, sir. How can I assist you today? Mr. Asante beamed. Now, this is the service we deserve. Patients are customers. If we don't treat them well, they will leave. PPWR: professional, personal, warm, responsive service should be every healthcare worker's mantra. Great service isn't just about medicine, it's about people. In healthcare, we don't just give lives, we serve them. Thank you for listening to Say It Podcast.